Sometimes folks ask me, what is the best advice you can give me as I'm preparing to go on Medicare? I'll be going on Medicare in a few months. Hopefully it's not a few weeks, because then we everything's in a crunch. But what is the best advice I can give you? The best advice is to do your homework before you get down to the wire and look at some of these options, and don't just be sucked in by the fancy pitches about, there's no premium and there's free dental and vision and all this other kind of stuff. And also, don't just say, well, I've been on the employer plan for so long and they've got a plan for me. I'll just stay with that, and if it doesn't work out, well, I'll change at some point in the future. So the best advice is to do your homework and do some research on this before you get to the very last minute. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, I understand that Medicare is confusing. When I first looked at shifting my focus, now I've been in the health insurance business now for over 45 years. And about 10 years ago, a little over 10 years ago, I decided that I was tired of working with the market that I was with. It was setting up employer plans and individuals who were self-employed. And it was really just getting to be a hassle and a drag. And so I thought, well, okay, I'm getting close to Medicare age. At least that at that time I was getting close. I'm already there, and I passed that milestone about 6 years ago. But I decided to look at Medicare, and I thought, well, this shouldn't be so difficult, because I've been in the health insurance business for a long time. So it's just a matter of, looking at things a little bit differently. Boy, was I wrong. It's very confusing. And if it's confusing to me, somebody who's been in the health insurance business for many, many years, it's got to be real confusing to other folks out there. But one of the things that I would say is do your homework, and don't just jump into things and assume, well, if it doesn't work, I'll just change during this open enrollment period I hear about. That's not always an option for some people. So before you make your decision, before you get to 65, make sure that you make the right decision, and one that you can live with for a while, if the rest of your life possibly. So, this is not something to be taken lightly. Let me give you an example of why you should look ahead. Talking with a lady right now. She's worked for a government entity for a number of years, and she's had a health insurance plan that has worked fairly well for her, although she's had some pretty heavy out-of-pocket expenses because, well, she's had some health issues leading up to this. By my memory is about 5 years ago, she had a particular type of breast cancer, and it was caught early, and everything was fine. But then a few years after that, she had a different kind of cancer, and it was much more aggressive and much more invasive, and she ended up having to go to MD Anderson. It's a big cancer center out in Texas. She didn't have to go, but she wanted to go out there. And so she did, and she, was pleased with the care that she got out there. The plan that she was under at the time had a provision where you could go you could seek treatment in other states, and there were no problems. Well, as she was approaching 65, she knew, because she has to have checkups every year locally for the breast cancer, and she also has to go to MD Anderson, I think it's a couple of times a year, for some follow-up tests and so forth there. And her employer offers a Medicare plan, but it's a Medicare Advantage plan. It's a PPO. And as she went looking further, even though she was told, oh, you can use it anywhere, it's got a national network and so forth, she started digging further and she found out that MD Anderson doesn't take most Medicare Advantage plans. There's a couple that are local there in Texas that they will accept, but most Medicare Advantage plans they do not take. So if she wanted to continue having follow-up checkups and so forth at MD Anderson in Texas, she was going to have to look at original Medicare and a supplement plan, and that's how she found me. I've got a YouTube channel. I got several videos, about 100 videos up there now, and there's more than one of them that address this issue about access to care when you have a PPO plan such as a Medicare Advantage. And you can't just go anywhere in spite of what you're told or even what you may have had when you were under a PPO plan through your employer. It's not exactly, things change when you go on Medicare, and a lot of the hospitals do not take most Medicare Advantage plans. So she contacted me, and we talked about the situation, and she said, am I looking at this right? And I said, yes, you are. Yes, you are. You were wise to do that rather than just jumping in and assuming because you had been able to go to MD Anderson under your group insurance plan, you could do the same when you get on Medicare. So this is one of those things that people don't always look at. They may reflect on some health issues they've had in the past, maybe even some that are going on right now. But they don't necessarily think in terms of, do I need to check this out and see if I can go to this doctor or that clinic or something like that once I get on Medicare, and especially if I go on a Medicare Advantage. So if you've got some questions like that, give me a call. I'll be glad to talk to you about it. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.